Good afternoon, everyone, ladies and gentlemen. Thank you for joining today's webinar that CSIS is hosting on Indonesia-Korea cooperation in dealing with COVID-19, lessons from both countries. Please allow me to introduce myself. My name is Shafiah Muhibat. I'm the head of the International Relations Department at CSIS. So CSIS has been very active in running a number of activities with relations to the COVID-19 pandemic, including various webinars that we've been hosting. So thank you again, everyone, for joining us in today's session. Today's session is specifically designed as we would like to discuss about the cooperation between Indonesia and the Republic of Korea. As we may be aware of, Indonesia and ROK has sought to boost its ties and cooperation. So since 2017, the leaders of the two countries have agreed to elevate the bilateral relations to a special strategic partnership through the Korea-Indonesia Joint Vision Statement for Co-Prosperity and Peace. However, looking at the current situation right now of COVID-19 pandemic, the pandemic poses a new threat against developing landscape of Indonesia-ROK relationship. We are aware that the rapid outbreak of the virus across border is already disrupted various international and economic agenda between countries in the region, and this includes both Indonesia and the ROK. As part of the existing bilateral framework between the two countries, some initiatives have been taken. The news have reported this includes medical product export and aid package from Korea to Indonesia. However, we must keep in mind that the upcoming challenges will not only be related to redistribution of medical supplies, but we also will share the same aftermath burden after the pandemic is over, hopefully. This aftermath will include possible economic crisis and the need to rebuild and reform regional and global public health regime. So it's a big topic that we are discussing today, but we are lucky that we have a number of very good panelists, excellencies, and speakers. I will introduce them one by one very briefly. So the first to speak and will give the remarks to kick off discussion would be His Excellency Desra Percaya, the Director General for Asia, Pacific, and Africa, Ministry of Foreign Affairs of the Republic of Indonesia. Followed by two panelists, experts from the two countries. First is Dr. Youngmee Jee, KF Special Representative for Health Diplomacy and Advisor of the Global Center for Infectious Disease of the Seoul National University College. Followed by Dr. Philips Vermonte, the Executive Director of CSIS, and also the convener of CSIS Disaster Management Research Unit, who have been following very closely the issues of pandemic in Indonesia. After the two panelists, I would like to kindly ask His Excellency Kim Chang-Beom, the Ambassador of the ROK to Indonesia, followed by His Excellency Umar Hadi, the Ambassador of Indonesia to ROK, to also discuss with us, aside from the issues of the pandemic itself, how does it relate to the bilateral relations between Indonesia and the ROK? So without further ado, I would like to ask Pak Desra Percaya to kindly begin the discussion with your remarks. Please, Pak Desra.
Thank you very much, Moderator. I call her Ibu Vivi. His Excellency Ambassador Kim Chang-Beom. Can you hear me, Ibu Vivi?
Sure, yes.
All right. His Excellency Ambassador Kim Chang-Beom, His Excellency Ambassador Umar Hadi, my good friend, dear Philips Vermonte, Executive Director of CSIS, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon, Annyeonghaseyo. It is indeed a distinct honor for me to be part of this very important webinar. I congratulate Pak Philips and his team at the CSIS for this excellent initiative. During this fasting month, when activities are normally slowing down, I welcome that CSIS, an important partner of the Foreign Ministry, remains active in our collective efforts to further promote cooperation between Indonesia and ROK. Colleagues, While global economic recovery amid the new normal is still uncertain, the outlook becomes grimmer with the ongoing COVID-19 pandemic. No country, no matter how powerful or prosperous, is immune to COVID-19. Indeed, difficult times like this serve as a litmus test to global solidarity. Indonesia believes that overcoming COVID-19 requires coordinated global responses to ensure all countries have the necessary support and capacity. On our part, Indonesia has continued to work hard to fight COVID-19 in the country, including by establishing a task force for COVID-19 mitigation, allocating special budget to support its economy, and improving the capacity of hospitals to conduct testing and treat patients. While certain policies might prove effective to protect people's life, at the same time, they may also bring side effects detrimental to the economy. In this context, each country has its own dynamics and challenges. Thus, there is no one size fits all, nor perfect formula to respond to this challenge. Therefore, it is imperative for both Indonesia and ROK to work closer, share respective best practices and lessons learned in mitigating the multi-dimensional impact of COVID-19. Colleagues, Indonesia and ROK enjoy a special strategic partnership since 2017, as has mentioned earlier by Moderator, a partnership built upon the principles of mutual respect and mutual benefit, a partnership in times of good and bad. The two countries just concluded negotiations on the Indonesia-Korea Comprehensive Economic Partnership Agreement, and in order for this IKCEPA to work, however, we should first address, adapt, and adjust to the new normal by working hand in hand to revive international trade as engine for growth. In this regard, COVID-19 has opened up a new dimension to our elevated partnership. In a phone call conversation last month, President Joko Widodo and President Moon Jae-in agreed Indonesia is a priority country to receive medical supplies, including test kits from ROK. The two countries commit to have an innovative cooperation to address COVID-19 through production of medical equipment and medicines and increasing production capacity of Indonesian companies. ROK also to provide Indonesia with medical supplies assistance in form of rechargeable battery spray and diagnostic kit worth at around 500 million US dollar. In the context of B2B cooperation, ROK companies are in close contact with their Indonesian counterparts through joint research and development for ventilators, joint production and product development for personal protective equipment, diagnostic reagent, rapid tests, and therapeutic medicine. Through such cooperation, Indonesia and ROK can contribute to help strengthening the supply chain of medical equipments and medicines to further enhance our preparedness against COVID-19. At the same time, it is also a clear testament of how resilient our spatial strategic partnership is against a dynamic and ever-changing world. With this, I end my remarks by wishing everyone a fruitful discussion. Thank you very much. Hamza Hamnida. Wassalamualaikum warahmatullahi wabarakatuh. Thank you, BVV.
Thank you very much, Pak Desra, for the remarks. And I think it gives us a very good basis for further discussion with relations to the Indonesia-ROK relations. Just to inform the participants that Pak Desra will have to leave for another meeting at 3 p.m. So if you have any questions, we will then have to follow up to Pak Desra's email. I hope that is okay with you, Bapak.
No problem at all.
Okay, thank you. Thank you again, Pak Desra, for your remarks. I will now move to the first panelist for today, Dr. Youngmee Jee, who will present Korea's efforts in terms of the COVID-19 pandemic. Over to you, Dr. Jee.
So thank you very much, Excellencies and ladies and gentlemen. So can you hear me all right?
Sure, yes.
So good afternoon. It is my pleasure to meet you all online to share Korea's public health responses to the COVID-19 outbreak. So during last 3 months, everyone across the globe is living in a completely different world. The crisis we are facing now is teaching us how much viruses can be devastating and have impact on all aspects of our life. And the people are talking about the new post-COVID-19 world that we will be living in after COVID-19 crisis. So while all countries are suffering from the impact of this outbreak, Korea has been considered as one of those countries which have been responding relatively well. So now I'd like to share with you the experience of COVID-19 response in Korea. Next slide, please. So this slide shows the outline of my talk. And next slide, please. So you can see the report from all 6 WHO regions to WHO headquarters. As you all know, WHO declared public health emergency of international concern on January 30th. And globally, as of 4 May, there have been more than 3.4 million confirmed cases, including around 240,000 deaths reported to WHO. And now most cases are reported from European region countries, indicated in green color, and American region in yellow color. And in fact, the Western Pacific region, including China and Korea, reported most cases in the early stage of outbreak. And Southeast Asian region, where the Indonesia belong, still has a relatively small number compared to other regions, but I suppose still has a trend of rapid increase. Next slide, please. So from this slide, you can see the trend of all WHO 6 regions. And please note the scale of the y-axis is different. The scale of Euro and PAHO, which is American region, which is much bigger than the other regions. So as I mentioned, Sierra is in the center, bottom. Sierra still has an increasing trend, and we are all worried about the African region, which is top left, with very low resources and capacities. And next, please. So here you can see the data from Sierra, including Indonesia, and Wipro, including Korea, as of May 3. The number of confirmed cases from Indonesia surpassed Korea, but population size of Indonesia is much bigger than Korea. I think 2.5 times bigger than Korea. But also we have to consider how extensively the testing has been performed. Next slide, please. So now I'd like to briefly mention about the Korea's WHO's International Health Regulation and recommendations from WHO COVID-19 Emergency Committee which I'm participating as a member. The WHO has authority to declare public health emergency of international concern based on international health regulation. So IHR has been revised in 2005 and effective from 2007. And IHR is intended to help and prevent the spread of disease across borders and outlines the minimum requirement for functional public health system, which allows countries to quickly detect and respond to disease outbreaks in their communities. So far, WHO declared 6 public health emergency of international concern, so-called FAKE, including current COVID-19 outbreak. So the list of FAKE includes the 2009 novel swine flu pandemic, in 2014 wild polio, in 2014 West Africa Ebola, and 2016 Zika, and then 2018 to 20 DR Congo Ebola, and then lastly current COVID-19 outbreak. Next, please. So here are the recommendations from the second committee, which was held on 30th of January. So there were recommendations for WHO and China, and also to all countries. And as a member of this committee, I strongly recommended organizing WHO China joint mission as soon as possible to understand the situation in China. So this actually happened during February 16th to 24. And this provided detailed information on China's situation. And also to WHO, the committee recommended to provide support to the countries and regions with vulnerable public health infrastructure and collaborate with them. To China, committee emphasized to conduct access screening to identify infected travelers and to minimize travel restrictions from China to other countries and collaborate with WHO and other partners. To all countries, WHO did not immediately recommend any travel or trade restrictions based on current information available at that time, but we all know that those restrictions has been done by many, many countries, almost all countries. And then based on these recommendations, WHO DG declared the public health emergency on January 30th. Next, please. And then 3 months after, there was another emergency committee on April 30th. And of course, all members of the committee agreed that this COVID-19 should be continues to be the fake, and provided additional recommendations to WHO and all countries. So the advice to WHO included WHO's role on coordination and planning and monitoring by working with fragile states and vulnerable countries, and providing further guidance to countries about adjusting public health measures and inclusion of all low and middle income countries in the solidarity clinical trials for therapeutics and vaccines. And the committee also emphasized the aspect of One Health and maintaining essential health services, as well as risk communications and community engagement. Next, please. So as China WHO joint mission happened February this year, a similar mission was organized in June 2015 during the peak of MERS outbreak in Korea. So after this WHO Korea joint mission, emergency committee meeting was held in Geneva during the following week, but fake was not declared by WHO at that time. But from this very painful outbreak, Korea was able to learn many lessons. Next slide, please. So those lessons learned were implemented as actions in Korea. So in terms of governance, dedicated emergency operations center and laboratory analysis center was established in Korea CDC, and also regulatory framework for emergency use licensing to produce diagnostic kits during the emergency was also negotiated with the Ministry of Food and Drug Safety. And we also tried to strengthen the infrastructure which would be needed to respond to outbreaks. But of course, we cannot say this is really enough now. If we experience a surge of COVID-19 outbreak like New York, perhaps, we will still need more infrastructure to deal with the outbreak, which could go beyond our current capacity. Then in terms of risk communications, we had some issues at that time during MERS outbreak on transparency and speed of sharing the new information with the public and media. So Korea CDC established the dedicated risk communication team, which I think during current outbreak was very efficient. Next slide, please. So here you can see the timeline of early stage of COVID-19 public health responses in Korea. So the January 3rd, Korea CDC activated Emergency Operations Center, and January 6th, it allotted clinicians to look out for the patient with respiratory symptoms with history of visit to Wuhan, China. And you can see all this timeline until January 20th. And most importantly, those actions were taken before WHO declared public health emergency of international concern. Next slide, please. So next slide actually shows, this is a very busy slide, but it shows all those actions taken during the course of outbreak. And there were major clustering among religious groups, which is indicated in a red box, called Shincheonji in Daegu. And after confirming the patient 31 was related to this Spatial religious group, and the other outbreak indicated in red box in the middle is the Guro Call Center in Seoul. So everyone related to these groups were tested, and many additional cases were confirmed from those groups. And government established community treatment centers, which I will explain later for mild cases, and some innovative ways such as drive-through centers and very special entry procedures. And those procedures were gradually expanded to all incoming travelers. So during last 2 weeks, actually, the Korea had confirmed around only around 10 new cases per day. And those cases mostly are imported from other countries. And yesterday, actually, we had 3 cases. Today, only 2 cases, and those are all imported. Next slide, please. So I will briefly summarize Korea's responses to COVID-19. Firstly, in terms of testing, there was a fast-track preparation of COVID-19 testing kits in collaboration with the Ministry of Food and Drug Safety and also pharmaceutical companies. Also, the number of testing labs in Korea was expanded quickly to enable at least 20,000 samples per day. And later it was expanded even further to 30,000 to 40,000 per day. And as you all know, the innovative sampling method of drive-through and walk-through were introduced. So far, Korea tested around 640,000 tests, and around 1.7% were positive as of May 5. And obviously, testing results will guide us who should be isolated, including asymptomatic cases, and who should be quarantined. Next slide, please. Now moving on to the tracing and isolation and quarantine with ICT support. The Ministry of Interior and Safety developed the Safety Protection mobile app using GPS to keep track of the people's location to ensure people are not breaking their quarantine and to allow those quarantined people to stay in touch with government offices. Still, this is not mandatory, and telephone calls will still remain as an option, as a possible option. And in addition, CCTV analysis and credit card transaction log information were also used to track the movement. And of course, this can raise the issue of privacy, but after 2015 MERS outbreak, government actually amended the relevant laws to allow this epidemiological investigation. Next slide, please. So this slide shows Safety Protection mobile app for self-quarantined isolated people on the left-hand side, and the right-hand side also there is a separate map app for the government offices. So government offices will monitor those quarantined people. Next, please. The next slide shows the COVID-19 smart management system to support epidemiological investigation of Korea CDC. And this system was jointly developed by the Ministry of Land and Infrastructure and Transport, and Ministry of Science and ICT, and Korea CDC. And this was operated from March 26 in collaboration with Korean National Police Agency and Credit Finance Association and South Korea's 3 mobile carriers and 22 credit card issuers. This system actually enabled the quick tracking and investigation of movement of cases. By introducing this system, the time needed for investigation could be reduced from 24 hours to 10 minutes, and all data could be safely managed automatically online. A real-time data collection has been possible. Next slide, please. So government also introduced spatial and entry procedures, and this procedure was gradually expanded to all incoming travelers from March 19th, including all Korean and foreign nationals. Also, we began COVID-19 testing for all travelers coming from Europe and US, and those people tested for virus need to wait for 24 hours until the test results are received. Next slide, please. So next slide shows treatment. So the cases were classified based on severity, and community treatment centers, as I mentioned earlier, were established for mild cases to prevent overwhelming of hospitals and to enable severe patients to be properly treated at the hospitals. So mild cases isolated and monitored at the community's treatment centers actually twice a day by healthcare workers. And during the peak, 329 hospitals were designated as COVID-19 hospitals while ensuring hospital accessibility and safety of non-COVID-19 patients. And next slide, please. So next slide shows the one example of community treatment center we operated. So as of March 15, 16 centers accommodating 2,620 mild cases were operated, and there were 409 dedicated medical staff who monitored those cases. And most of those community treatment centers are now closed because we don't really have that many cases. Next slide, please. So now everyone is taking talking about the social distancing. The Korean government actually implemented social distancing policy, including school closure and cancellation of major event from an early stage of the outbreak. So starting from today, relaxed social distancing, so-called daily life distancing, is being implemented after extended voluntary social distancing until yesterday. So online school began from April 9, and stepwise opening of schools is planned from May 19. And the national guideline for school opening has been developed by the government. Next slide, please. The next slide actually shows documents from WTO European Region. I thought this might be also useful for everyone. So this documents guide the strengthening and adjusting public health measures throughout the COVID-19 transition phases. So this document describes 4 key components to manage transitions and modulate restrictive measures, and 6 conditions as the basis to implement and adopt transitioning of measures, and 4 cross-cutting mechanisms essential to transition process. Next slide, please. So Korean government also developed graded social distancing policy. So less than 50 new cases per day, known source of infection less than 5%, number and scale of clustering cases, and over 80% known IP-linked the criteria for the risk assessment. And government also announced basic principles of social distancing at the personal and community levels. And government will adjust the 3 levels of social distancing by regular risk assessment. So level 1 is daily life physical distancing. Level 2 is social distancing. Level 3 is enhanced social distancing. The transition must be guided by public health principles and economic and societal considerations. Next slide, please. So risk communication with the public and media has been a very critical part of the response. There has been media briefing from the day of the first case, twice a day, morning and afternoon. The messages from the government has been quite transparent and clear, and efficient communication during the course of outbreak enhanced public trust in government actions. There have been close collaboration with expert committees and task force on clinical epidemiology, lab testing and public health measures for key decisions. And our national election, you probably heard, was successfully held on April 15th as planned, with record high turnout rate of 66.2%. And government ensured strict hygienic measures of such as disposable gloves, masks, and 2 meters distancing between people. And no COVID-19 cases related to the election were reported so far. Next, please. So while somehow WHO has been criticized for its slow action, in fact, WHO published quite useful guidelines, including a strategic preparedness response plan on February 3, with 3 areas. And one area was accelerating R&D and organized R&D forum to establish the research roadmap on February 11 and 12. And April 14, another updated strategy was published with overarching goal of slowing down transmission and reduce mortality. Next slide, please. So next slide is showing the timeline of rapid research response coordinated by WHO, actually starting from December last year. And before the declaration of public health emergency, there was already discussion on research and development. So next slide, please. So this slide I borrowed from Dr. Mike Ryan of WHO. This shows the global development for therapeutics and vaccines. And as you all know, no licensed therapeutics yet, but many clinical trials are ongoing, especially for Solidarity International trials to compare 4 treatment options. And over 1,600 patients are enrolled from 11 countries. In terms of vaccines, there is also a broad global coalition to develop and evaluate candidate vaccine as quickly and safely as possible. And currently, over 120 vaccines are in development. Among them, 6 are on clinical trial. And access to COVID-19 tools accelerator has been launched from April 24. And there is very close collaboration of CEPI, Gavi, and Global Fund, UNITAID, and WHO at global level. Next slide, please. So I tried to summarize the lessons learned from COVID-19 outbreak responses. So we still do not know when this outbreak will end, but during the course of outbreak responses so far, we now know early action is the key. And also Asian countries with previous experience from MERS or SARS performed quite well. So those countries could include my country and Hong Kong and Taiwan. And easy access to medical services was one of the key factors for our success, I believe. And Korea has a very high number of hospital beds compared to other developed countries, as you can see from the slide. And also the whole of government and society approach, such as coordination between central and local government and different ministries and public and private and academic societies be critical. Another area would be transparent risk communication efforts, which I mentioned, with a clear and a coherent message to the public and media. This will bring the trust in government and definitely will lead to the full community engagement and support. Lastly, innovative technologies such as drive-through, walk-through, and smart tracking system using ICT play the role in terms of speed and efficiency. And next slide, please. So although Korea did relatively well so far, there are still many areas for improvement, such as timely and robust analysis of epidemiological and clinical data we have accumulated so far. And this would be important to understand many unknowns of this virus. Secondly, the number of public health experts, including infectious disease experts, epidemiologists, microbiologists in Korea is relatively small. And we need to invest more for the human resources, and also we need to secure infrastructure in preparation for surge. And although interministerial and public-private collaboration has been a critical part of success of our response, we need to continue these efforts, especially for research and development, by scaling up of investment, as well as collaborating with WHO and other global partners. Lastly, how we could apply the graded social distancing policy based on public health principles and economic and societal considerations would be the key for sustain our success. Next slide, please. So during the last few weeks, many countries asked Korea to share the experiences or send the kits or medical equipment. And there have been many interviews at all levels, public and private, politicians, ministers, professors, scientists, and over 170 webinars, video conferences, teleconferences were held with around 50 countries and international organizations to share our experiences. And our foreign minister had an interview with BBC, and President Moon gave a speech during G20 summit emphasizing openness, transparency, and democracy in responding to COVID-19. And I believe there has been also collaboration between on COVID-19 between Korea and Indonesia prior to this webinar. And I understand WTO requested a keynote speech to the President Moon during the World Health Assembly in May. He will probably talk about Korea success, a K success model for COVID-19. And therefore, I would hope Korea would continue to do well so that our model of COVID-19 response does work. And Korea could be considered as a country which successfully flattened the epidemic curve. However, we all know flattening curve cannot be sustained until the whole world defeat the virus together. So I do wish Indonesia success also in defeating COVID-19. Next slide, please. So global COVID-19 outbreak opened the new world of global collaboration. And obviously today's webinar is one of those efforts. And we should continue to work together and share our knowledge to tackle COVID-19. I thank you all for your attention.
Thank you, Dr. Jee, for your presentation. So before I move on to Dr. Phillips, I would like to quickly remind all participants joining us in Zoom, you can start already posting questions in the Q&A feature here in Zoom. Those joining us on YouTube, you can post your question through the live chat feature in YouTube, and we will transfer your questions then to Zoom. So I will then read the questions to the panelists. It would be very helpful if you could be very brief and address your question to a specific panelist. So now over to you, Dr. Phillips.
Thank you, Fifi. Let me share my slide presentation. Hold on. Let me figure out how to share the screen. Oh, there you go. All right, thank you, Fifi, and thank you for the Korea Foundation for helping CSIS organizing this, and also Ambassador Kim and Ambassador Umar Hadi in Seoul. I will speak about Indonesia's experience, but I'd rather expand the horizon a little bit. I'm not going to talk on the nitty-gritty of how the Indonesian government has been dealing with the COVID-19, but I'd like to highlight some, just some important parts and try to look at beyond COVID-19 and what Indonesia and ROK can do together in the future. Now, I'll have 3 discussion points for the next 20 minutes. It is based on the understanding that COVID-19 has exposed vulnerabilities in various aspects of governance in Indonesia. Number 1 is on the decision-making, on the institutional capacity of the government, both at the national and the local level. It relates to Indonesia being a big country with a large size of population and geography. And then we have cultural and religious diversity that sometimes become a factor in our efforts in tackling the problem of COVID-19. And the second discussion point that I'd like to highlight is that regarding the disaster or crisis preparedness in Indonesia, that relates to happens in the context of decentralization in Indonesia. And lastly, very, very briefly on the healthcare system. And here I'd like to give you some caveats that I'm not an epidemiologist, but I try to look at it from policy perspective. Now, let me start by fact and figures in Indonesia, at least until yesterday. We see that the number of total confirmed cases in Indonesia still on the rise. And then in terms of daily new cases, it's very volatile. Sometimes we have a good day where we have less than 200 new confirmed cases, but sometimes we have more than 400 new confirmed cases in Indonesia. So it keeps fluctuating, meaning that there are something going on in our efforts. Sometimes we are successful, sometimes we're not, or whatnot. So far, the number of active cases also, I think, is still on the rise. And then the number of death related to COVID-19 also is still increasing. So all in all, I think Indonesia is still in the middle of the struggle to tackle this problem of the spread and the fatality of COVID-19 in Indonesia. Now, my first discussion point is that in terms of decision making and institutional capacity. Now we know that from the previous presentation, we know in Korea there was a swift policy and action on the part of the government. In Indonesia, in the beginning, we saw a very slow response. And then in the middle, we still have a kind of a half-hearted policy that I'll come back later. To give you the idea of why it is the case, we know in Indonesia, the first confirmed case was announced on 2nd of March 2020. But the presidential decision or Kepres on the establishment of the rapid response team led by the head of our disaster mitigation agency was issued on March 13. So there's almost 2 weeks lag between the first confirmed case and the establishment of rapid response team by the government. When it was announced, the number of confirmed cases was already 69. And then the rapid response team or gugus tugas announced the status of non-natural emergency situation on March 14, when the number of confirmed cases already is 96. And then we know that the large-scale social restriction or PSBB was implemented on March 31st. So almost a month from the first case into the swift response by the government. So I think this is one of the problem and the lessons that we need to learn. Why is it the case? And then what can we do about it? And after that PSBB first announced by President Jokowi, the Jakarta province was given the permission to announce the provincial PSBB status on April 10th. And as we know at the time, and still until today, Jakarta is the epicentrum of Indonesia in terms of number of cases and in terms of number of deaths. But again, this is April 10th that it was granted. And then the West Java province, the second epicentrum in Indonesia, the large-scale social limitation restriction was implemented starting today, actually. So we see this is partly because of the kind of a bureaucratization of this tackling of COVID-19 in Indonesia, relating to the fact that Indonesia is decentralizing, Indonesia is democratizing. So there are so many veto players, there are so many factors to be counted in. Now, we also see the slow and half-hearted policy to implement stronger measures. There was a visible flip-flopping decision in banning annual traveling, exodus during the fasting month of Ramadan. This is the annual, akin to the Chinese New Year when Wuhan became the epicentrum in China. That after that, during that holiday season related to the Chinese New Year in China, because people were traveling here and there in a large number, then you cannot contain the spread of the virus. And here in Indonesia, the government, some of the ministers were flip-flopping in implementing stronger measures to ban this annual traveling that contain high risk of spreading the virus out of Jakarta as the epicentrum or out of West Java in that case. So what we have seen is mixed results of our large-scale social restriction of PSBBs in Jakarta or in other places in Indonesia. See, this is the graph I took from my colleague. They published it yesterday on CSIS commentaries. They are evaluating the PSBB implementation in various, in Indonesia, and then how it relates to the increase or decrease of cases in Indonesia. So the larger, the darker green bar denotes the period before the PSBB was implemented, and the lighter green bar denotes the period after the PSBB was implemented. And the dark dotted line highlight the average number of cases at the national level before the PSBB, and the gray dotted line is the average after the PSBB. So we see actually on average, we see lesser number of new confirmed cases after PSBB was implemented. So this is a good news. But you see, in terms of provinces, the number, various places, we see increased new confirmed cases across provinces in Indonesia. So you see, especially in the eastern part of provinces in the eastern part of Indonesia, and then the Central Java and other provinces outside Jakarta and West Java, we see a number of increased new confirmed cases. So that means, regardless of the fact that the government encouraged people not to do the traveling, this needs to be tested. We actually did test it by using other data, Facebook disease prevention map. The PSBB so far, because of the flip-flopping and then the lesser than stronger measures, was not really effective because people already left Jakarta to other places. Now, second part of my discussion point is on the disaster preparedness. We know now that the National Disaster Mitigation Agency, BNPB, the agency that is mandated to lead this the government effort in tackling COVID-19. We know that BNPB was the institutional setup of BNPB is oriented primarily to deal with natural disaster. So not to deal with non-natural disasters. But they have a good institution to deal with the natural disaster. They know how to manage crisis, but they need very tight cooperation with other institutions, be they Ministry of Health, local governments, central governments, and so on. And they need help, technical helps in dealing with these non-natural disasters. That's number one in terms of disaster preparedness. Number two, as is with the government, the national government, BNPB is also decentralized in nature. No direct line of command between BNPB at the national level and the BPBD at the local level. So BPBD at the local level is under the local government, the governor or the mayor or the head of district. So, but BNPB and BPBD, they do have good cooperation, but not in the chains of command. So we need to do something about how we actually rethink about the institutional setup of our National Disaster Mitigation Agency. Number three, because of the decentralizing nature, there are variations in institutional capacity across regions in Indonesia, across local governments, across BPBD, and so on. So this is a governance problem as well. And we need to think beyond this COVID-19, because what we are facing right now, I think, is a function of our lack of institutionalization in disaster preparedness. Number three, in terms of briefly on the governance and healthcare system, compared to other countries, some people said that it's not apple to apple to compare, but if we do the counting in terms of testing capacity, Indonesia is pretty low in terms of per 1,000 people. It's currently at the rate of 0.18, while Korea, number of tests per 1,000 people is 11.5. Italy, regardless of the fact that they are facing a serious problem with the COVID-19, but they do have a high testing capacity. And compared to our neighbor, Malaysia, we are far below. And in terms of case fatality ratio as well, Indonesia is pretty high compared to South Korea and Malaysia. Now, I don't know whether you can see this, but I might skip this because it's too small. In the next slide, we see that in terms of preparedness of our health system, at least from one, there are of course many variables in this, but at least from the data from the World Bank, the total number of hospital beds in Indonesia from the period of 2014-2018 is rather small compared to the total number of people in Indonesia. That we have 250 million something people. The total number of hospital beds in Indonesia is only 280,000 beds across hospitals in Indonesia. If we take the ratio, then the number of beds per 1,000 people, again, the rate is pretty small compared to South Korea, Italy. Italy is pretty low as well, bearing in mind that they are a more advanced country. But compared to Malaysia, we are still also below. Now, there's this report that came out last year from the World Health Organization on spending on health. And actually, Indonesia, as a transitioning country, there's a change of government spending as a share of GDP. We are actually reducing 0.4%. And then this is, I think, something that now we need to rethink as well. While our economic growth has been good in the past 5 years, actually our percentage of spending, share of GDP in public spending as a share of GDP in Indonesia is actually decreasing. So what I'm saying is, structurally, there is a problem in Indonesia, institutional problem. Also, in terms of health, there are a lot of areas that we need to work on. Now, in the context specifically between Indonesia and South Korea relations, I think there are a number of recommendations that I can put forward. Number one, given what I have been explaining and listening to the previous presentation, I think there's a need between Indonesia and South Korea to enhance sharing and cooperation and to formulate cooperation mechanism between agencies designated to mitigate disasters in Indonesia and Korea, be they Korea CDC, BNPB, or the similar agency in South Korea. And in particular, I think I would encourage more cooperation between local governments in Indonesia and South Korea. Number two, given the need now of the investment of R&D, as Professor earlier stated, R&D creating a technology ecosystem that can be working together with the public health sector. I think we need to enhance learning and sharing mechanism between Indonesia and South Korea in normal as well as crisis time. COVID-19 makes every country think about itself, but day by day we know that we cannot do this by ourselves. We need to go beyond, protectionism, nationalism, or we can do more in the bilateral mode between Indonesia and South Korea. Number three, for the Indonesian side, I think Indonesia should welcome assistance from other countries, in particular from South Korea, in the area of capacity building in our health system. Can be on the science front, and the HRH, the human resources for health, medical science, nurses, and other areas and other elements. In particular, is this institutional building in overall aspect in public health is very important. So Indonesia should welcome assistance from other countries. Number four, I think previous speaker highlighted the IHR, International Health Regulation. So this is the area, I think exactly that Indonesia and ROK need to cooperate in the 8 core area mandated by the IHR. Policy and legislation coordination, surveillance, preparedness and readiness, response, risk communication. You know, I've been reading about the risk communication, successful risk communication effort in South Korea in dealing with COVID-19. Indonesia should learn from the experience, and human resources. And lastly, I think regarding the number of tests, the capacity to test and so on and so forth, we need to cooperate, and we need to enhance our labs, especially in the Indonesian side. We need more numbers of fully functioning labs in this particular area. So lastly, with regard to the local government, we need to enhance sister city mechanism between Indonesian cities or provinces with their counterpart in South Korea. Jakarta is a sister city, if I'm not mistaken, with Busan and so on and so forth. They work on smart cities and other initiatives. Now, I think public health related issue should also be put on the table. Now, Fifi, I think I should stop there, and back to you.
Thank you so much, Phillips. I can see that we already have a number of questions for our 2 panelists. But before that, I would like to give the floor to His Excellency Ambassador Kim Chang-Beom. If you would, elaborate on the current bilateral relations between Indonesia and ROK, and with relations to the COVID-19 pandemic. Ambassador, Your Excellency, the floor is yours.
Thank you so much, Dr. Shafiah, and let me first of all extend my warmest congratulations on the excellent presentation by 2 experts, Dr. Jee and Dr. Phillips. I think these 2 presentations are covering the whole aspects of our actions and reactions handling COVID-19. Dr. Jee is a renowned expert on infectious disease and also a member of WHO Emergency Committee. I think she has covered the expertise-based kind of experience and lessons that we have earned from our fight against COVID-19. On the other hand, Dr. Phillips has covered this Indonesia's case from more of public policy perspectives, covering governance, decision-making, policy infrastructures, and even the kind of the correlation between the centralization and decentralization, and how to deal with the future kind of policy dilemmas that Indonesia might be coping with. I think this Korea's case cannot be exactly copied into Indonesia's kind of a recipe, since I think there's Bapak Desra, DG from Ministry of Foreign Affairs, have rightly pointed out that there's no one-size-fits-all formula in tackling this global pandemic. But one thing is for sure, that I think there's cooperation and collaboration is another key to tackling this global pandemic, in addition to some of the points that have been well allocated by, eloquently presented by Dr. Jee. Let me touch upon the bilateral partnership that we've been kind of performing well in handling this COVID-19. Of course, this my dear colleague, Ambassador Papa Umar Hadi, might add some more valuable inputs to my comments. Well, this is quite crystal clear and simple. Why Korea and Indonesia are working so well in comparison with other partnerships with other foreign countries, because Korea and Indonesia so-called true, genuine partners. In bahasa Indonesia dan adalah teman sejati dan sehati. So it's quite self-evident that with that spirit in mind, also the closeness of hearts and minds of the people between the two countries, we've been building special strategic partnership, which has been shining in this time of crisis. I think there's, first of all, that Korea has designated Indonesia as a priority country in terms of emergency humanitarian assistance. So we have provided PCR test kit and disinfectant sprayers, total worth of $500,000 and also not only the government to government, but also from the private sector. Many of big business groups from Korea have donated test kits, personal protective gears, masks, and other relevant medical supplies to Indonesian friends. And also Korean community here in Indonesia have been joining hands together with the Indonesian partners to help kind of less privileged and vulnerable groups of people here in Indonesia. And not only on a bilateral side, but also on a multilateral side, Korea and Indonesia have been working together in upholding so-called multilateralism in fighting against this COVID-19. And President Moon and President Jokowi, both leaders have spoken the same language on the same chapter when they were attending G20 Spatial Virtual Summit in April. And then the Foreign Minister Ibu Retno and Foreign Minister Kang, both quite well-known women leaders in foreign policy communities, have been leading this efforts to tackle this COVID-19 through global collaboration and through coordinated responses at various fora. I think that's the spirit that we have been building on while handling this COVID-19. I think there's some of the recommendations that have been put forth by Dr. Phillips are quite relevant. I think there's those are the basis and that we could start to reflect on what we could work together for the future to come. And I believe that's, as was mentioned by Dr. Jee, there are some quite valuable insights and lessons that could be also learned and be taken into effect by the Indonesian policymakers, so that I think this is quite useful discussion that we are now holding on. Thank you.
Okay, thank you so much, Your Excellency. I would like now to turn to His Excellency Umar Hadi, the Indonesian Ambassador for Republic of Korea. Please, Pak Dubes Umar.
Thank you very much, Fifi. Pak Philips. I think after Pak Desra and then Ambassador Kim Chang-Beom, both are my mentors, and then presentation from Dr. Jee and Dr. Phillips, I think I have nothing left to say. But I just want to stress one point. You know, it just so happens today, May the 6th, is the first day in South Korea, except for Jeju Island, to apply what they call relaxed social distancing, or they have relaxed the guidelines for social distancing. But the guidelines which has been issued by the Korean government is very detailed. So in the past 2-3 days at the embassy, my team has been busy translating these guidelines into Indonesian language and in a more easy to understand manner, and post them in our social media so that the almost 40,000 Indonesian nationals living in South Korea can easily access and understand these guidelines, so that they can continue their life in a in a safe and healthy manner. And my message to Indonesians living in South Korea since 2 days ago, so starting today, is that with this relaxation of the social distancing campaign, it doesn't mean that we are going back to normal, going back to the way we live before the pandemic. Instead, it means that we have to move forward. We are moving forward to a new normal. And this is, the new normal is the way we live actively, but then in a more healthier and safer manners. So this is my message today to all Indonesians living in South Korea. To continue the discussion from Dr. Jee and Dr. Phillips Vermonte, I think if we look at the situation in Korea today and the situation in Indonesia today, there is a gap, there is a lag of about 2 months, 8 weeks, 6 to 8 weeks, right? Because in South Korea, we started earlier. The first case in South Korea was announced on January the 20th. In Indonesia, it was March the 3rd. So about 6-7 weeks. Now, if you look at what happened in early March, all over the world, the COVID-19 was still considered as something that has so many unknowns. The unknown factors were prevalent, right? But today, especially in countries like Korea, Taiwan, maybe Germany, there has been a lot of data, right, for the past 2-3 months. That would be very valuable if we can analyze, if we can take some lessons from these so many data. I'm sure in Korea, the KCDC has been doing this, analyzing and try to learn from this, the wealth of data that has been collected in the past 3 months. These new data, I think, would practically make the unknown factors of the COVID-19 a little bit familiar. And the experts, the researchers could shed more lights on what is going on, what works, what doesn't work, right? What policies should be pursued. So I think Indonesia can learn so much from this data, very valuable data. Therefore, my first, proposal or suggestion or idea, especially to Ambassador Kim and also Dr. Jee, and also the Korea Foundation, why not the KCDC and the related institutions in Korea help Indonesian authorities with this data? I think this is what we can learn now, so that although there is a lag of about 2 months between Indonesia and Korea, maybe Indonesia can do it faster. So that's my first point. I think a kind of more structured, institutionalized communication or sharing of, between KCDC and maybe the BNPB or Ministry of Health in Indonesia, so that Indonesia can also benefit from the data already collected in Korea. Because those 8 weeks or 2 months, 3 months data are very, very valuable. My second idea, proposal or suggestion is on the medical and pharmaceutical industry. It is clear that the whole world is having a problem with the supply side when it comes to medical equipment and pharmaceutical industry. And when I look at the data between Indonesia and Korea, I think the complementarity between our two countries is there. And I think we should benefit from that. So, well, actually, Ambassador Kim and I, we have been, let's say, starting to look at this issue quite progressively. And my proposal today, Ambassador Kim, is to try to get our two chambers of commerce and industries to discuss this issue more seriously, and to get some practical cooperation as soon as possible. Last point, number 3, and this is very special to me, and I think I also mentioned this in our previous seminar. One of my observations in South Korea is it is very clear that there is an urgent need of caregivers, especially for the senior citizens in South Korea. This is not, I always say to my South Korean counterparts, I'm not talking about the medical nurses. I'm talking about caregivers, medical who should have some level of medical knowledge, but and Indonesia is a supplier of these caregivers to Japan, Taiwan, United States, and other countries. So why not Korea? We can have practical and very rapid training sessions for some Indonesian, young Indonesians, and they can work as caregivers for senior citizens in Korea very soon. And I think it is a very good opportunity that we should look into very seriously. So I think those are my comments. And once again, thank you very much, Korea Foundation and Korean Embassy in Jakarta, and also the CSIS for organizing this webinar. Thank you.
Thank you very much, Pak Dubes Umar Hadi. So thank you for all the speakers for all the remarks and presentation. We have a long list of questions. So actually, if I'm going to try my best to sort of like put them together in different clusters to ensure that most of them, at least most of them, can be answered. But I would like to also ask all the panelists if it's possible that we extend a few more minutes after 3:30 to cater most of the questions. As we have just, had remarks from both the ambassadors, maybe I'll turn to your excellencies first. There are at least a couple of questions regarding the bilateral cooperation. So first in Zoom, there's Chuping asking about the South Korea's new southern policy and how it relates to this, and whether the ROK expect that the ASEAN +3 is a better regional framework than the bilateral ASEAN ROK to formulate COVID-19 response. And there is also another question in Zoom asking for, what type of bilateral cooperation between us, Indonesia and ROK that we will see post COVID-19? What issues can we develop further? So first, maybe I'll turn to Ambassador Kim first, and then to Ambassador Umar Hadi. Please, Ambassador Kim.
Thank you, Dr. Shafiah. Well, this new Southern policy is a new policy initiative that was undertaken by current President Moon when he embarked upon his new presidency. I think with that policy tenet in place, ASEAN has been once again on a highlighted position in our whole foreign policy radar screen. Out of 10 member ASEAN countries, Indonesia is standing as one and only country that is sharing this special strategic partnership. So out of 10 ASEAN member states, Indonesia is one and only country that Korea is labeling this special strategic partnership on a bilateral basis. And Indonesia is surely the leading country to lead the whole ASEAN community building. So on a regional kind of the cooperation framework, Indonesia is surely our leading partner. At the same time, on a bilateral basis, we have quite a robust economic partnership, and we have 2,200 Korean companies in operation. We have more than 25,000 Koreans living in Indonesia, and vice versa. In Korea, we have more than 45,000 Indonesians living in Korea. So I think there's it's quite well closely intertwined partnership that is evolving beyond economic partnership. It is moving toward all aspects of bilateral partnership. That's why I think this even in the midst of this global pandemic, both Indonesia and Korea have been working very closely together and to come up with quite innovative solutions to tackle our common challenge. And for what we could do after this whole coronavirus will be either gone away or be stabilized, well, there are some aspects that already been mentioned by Desra. So we have concluded the negotiation on Indonesia-Korea Comprehensive Economic Partnership Agreement, which is called IKCPA. It should be readily and speedily taken into effect through our own domestic procedure to be completed by both sides. Hopefully that within the second half of this year, we'll be completing our ratification process, both in Korea and in Indonesia. So hopefully by early part of 2021, next year, we'll be witnessing the actual implementation of IKCPA, which will boost the bilateral trade and investment flows. And also it will be rekindling interest of the Korean business community to come to Indonesia for their foreign direct investment destinations. And some of the policy perspective, I think there's Umar Hadi has mentioned some ideas. Of course, there's another area that we could cooperate together with would be a public health sector and how to mutually reinforce our medical and health industries in both countries after in the aftermath of this coronavirus pandemic. Thank you.
Thank you, Ambassador. Pak Dubes Umar Hadi, please.
Yeah, again, I agree 100% with Ambassador Kim. And I can tell you openly now that actually maybe between me and Ambassador Kim, we are among a very few ambassadors that can call each other almost every week. So a lot of things actually have been discussed between the two of us. Just one, you know, I don't know if I'm supposed to say that this in this forum, but let's just put it this way. Of course, this global pandemic is something very, very bad, that everyone is worried and concerned about the situation, including in the social and economic impacts of the pandemic. And this also, I think, apply when it comes to the economic relations between Indonesia and South Korea. But I can say this, few weeks ago, we had a very bleak view on this. But nowadays, when we look at the data, the hard data that we have, actually, it is not as bad as we expected it to be. So, for example, on the trade side, bilateral trade, we thought it would be more devastating. But actually, when we look at the hard data, especially on the first quarter of 2020, between January to March, it's not that bad. Our total trade only decreased for 11.5%. Our calculation in February, March, we thought it could be up to 25 to 30%, right? Now, on the second quarter, April, May, June, we thought our earlier prediction was continue to decrease for also about 20 to 25%. But we don't know yet what will happen, but I think it will not as bad as we thought it would be. Also on the investment realization from Korea to Indonesia, of course there is a decrease in the value of investment, but the number of projects actually was increasing on the first quarter compared to first quarter of last year. Most interesting is the number of tourists. This one is really, at one point we thought it would stop the travel with all the policies from both sides, restrictions and this and that, but actually at least for the first quarter until today, until end of April, it's not as bad as we thought it would be. And even for the travel, tourism from Indonesia to Korea, we already see some indications that it will pick up very soon. Maybe as soon as the Korean government relaxed its quarantine procedure, the number of travelers or tourists from Indonesia will pick up again very fast. And also the last one is, we also thought at first the economic crisis because of this pandemic would hurt very much the Korean manufacturing industry, and therefore many Indonesian workers will suffer because of no more work and so on and so forth. But we did a survey in March, so in the month of March, at the height of the pandemic in Korea. What happened is actually that, of course, there are these workers would have less hours, but because the foreign workers from other countries already moved out of Korea, the Indonesian workers who remain in Korea, now they can easily get jobs. So apparently, the situation of Indonesian workers in South Korea now, it is not as bad as we thought it would be. So this is apparently good, but we keep on following this situation, and we already see that there will be more opportunities for Indonesians to work in Korea in the future. Therefore, we are now advising the Ministry of Manpower in Indonesia to give some exceptions for the workers to go to South Korea. Thank you.
Okay, thank you. Thank you so much, Pak Dubes Umar Hadi. Now I'd like to turn to Philips first. There are a few questions addressed to you, I think. Most of these questions evolve around, criticism towards Indonesia's handling of COVID-19. There's a question from Mireille, for example, asking about the accuracy of statistics published by the government, suspicions regarding the data. And there is also a question regarding, can we do similar mass testing in Indonesia, or is it too late? And there is also a question regarding Indonesian medical infrastructure. Are we already overwhelmed? We don't have clear information on the Indonesian medical infrastructure with regards to COVID-19. And lastly, there is also a question whether Indonesia have a special strategy for the population in the rural areas. So if you could, briefly summarize among these few questions, please, Philip.
All right. Okay. I think on the data first, this is the most frustrating part, I think. But now it seems to me that we should give a benefit of the doubt to the government, that is, or to the authorities. It seems that the problem is not that the government wants to hide the data, but I would assume that this is an institutional capacity problem of gathering or collecting data in such a timely manner. It is, I think, what happened is this is a mess. Maybe they don't have a standardized, data collection mechanism across different agencies in Indonesia. That's why you've got this kind of seems underreporting data. That's my first response. Number two, somehow, maybe this institutional capacity, as I mentioned in my presentation, it's also related to the low number of testing that we have. That's why we could only detect a lower number of cases. Maybe there are cases that we cannot detect out there. So that's why the number is pretty small. But I would suspect the first reason would be that is the lack of capacity, lack of standardized data gathering or data collecting mechanism across different agencies in Indonesia. That's my first response. On the second question, on if I'm not mistaken, the rural preparedness, I think we've seen some statement and some policies from the government. We do have, for example, village, infrastructure, governance infrastructure down to the local level. The problem is, I think, whether or not people would follow instruction or procedures when they are dealing with COVID-19. It can be related to the religious belief. It can be related to socio-cultural, system in that particular rural areas. We've seen some reports across the media how, for example, people are still doing the Tarawih ibadat, at night, in some rural areas, even in the cities, and so on. So the problem is whether or not people will follow the instruction by the government. And comes from, I think this kind of obedience would come from the credibility of the government when they communicate, in a crisis time. So this is a kind of a chicken and egg question, which one should come first? But I would believe that if the government is solid, the crisis communication is solid, I think our infrastructure at the rural level would work quite successfully in tackling this problem of COVID-19 in the areas. And the third question I'd like to address, I browse the Q&A tab in my screen. There are questions about the local governments and so on and so forth, if I'm not mistaken. This is, I think, the problem of our democratic system we have to accept. But now, in my opinion, the priority should be given in the health area. We know it is painful economically speaking, but without tackling the problem on the health front, we will not be able to tackle the economic front as well. And there's this question about the biosafety level lab. How far can Indonesia conduct research on this COVID-19? This is also, I think, a critical question. I'm not very optimistic on this front. That is because of the COVID-19, the government earlier this year already announced that it would allocate 42 trillion for research, which is a very high number, I think, in the Indonesian context, that the government wanted to start to seriously fund research in Indonesia. They allocated already earlier this year 42 trillion, but because of the COVID-19, the research fund was the first one to go. The government cut 40 trillion rupiah. So now it's back to the low level of funding for research, and I would suspect this will affect our ability, our labs, our biosafety lab, and so on and so forth. And not only that, but in general, our research capacity will be seriously affected. I think back to you, Vivi.
Thank you so much, Phillips. And lastly, I would like to turn to Dr. Jee. There are quite a few questions addressed to you. If I could try to summarize them. Most of the questions ask for further elaboration, because you mentioned a list of Korea's policy in handling COVID-19. So, for example, first on social distancing, there was a question about how South Korea enforce physical distancing, because in Indonesia we've been having problems in trying to enforce that, and whether there's a scientific explanation why 2 meters for physical distancing. There's also a question regarding mass testing, for example. How was it conducted? Is it free of charge? And there is also a question regarding, preparation. Is ROK already preparing for post-COVID-19 situation, especially in terms of the economy and also to prevent, new cases? And lastly, there is a question specifically on, because you mentioned regarding elections as well. Indonesia decided to postpone regional elections this year. What was the rationale for the decision in ROK to move ahead with some of the elections? So over to you, Dr. Jee. I'm sorry if there's plenty of questions to answer in such a short period of time.
Oh.
Dr. Jee, are you still with us? Yeah, you still have your...
Sorry, my microphone. Can you hear me now?
Sure, yes.
Yes. So in terms of social distancing, I think different countries are applying different distance actually. So in Korea, to be safe, we are applying 2 meters. For some countries 1.5, some countries maybe less. Depending on how safe you want to be, and the distance which droplet can actually reach is much less than 2 meters, but to be safe, we are applying 2 meters. That same distance was applied for MERS cases in 2015. So that's the explanation for the social distancing. I think for the economy, that's probably not my area to comment. But I see some other questions from the Q&A sessions, such as IVI collaboration, International Vaccine Institute. Actually, we are quite closely collaborating with International Vaccine Institute for the vaccine area. And then for the election, I think the cases really was dropping dramatically when we approached the election day. So we were worried before the election, but by the time we reached the election date, it was really quite a small number only. And that's the number which our authority, national authority, could manage. So we could just reinforce those hygienic measures, as I explained. So those basic principles for social distancing was very strictly applied. So we were also worried, but I think the cases were already really very much dropped. So we were able to go ahead, and everybody was really keeping all those precautions very carefully. And then there were some questions on spatial entry procedures. I think that now applies to all countries. All incoming travelers should be followed on that procedure, but it was based on risk assessment. So starting from China and then expanded to the European countries and then US now. So that those were they gradually expanded. And I just want to lastly mention about joint external evaluation. That's actually done in both Indonesia and Korea in 2017. I tried to see actually the outcome of those evaluation because of MERS outbreak in Korea in 2015. We really tried to change all those capacities for the emergency response. So by 2017, when we received joint external evaluation, we were able to get quite high score. And for Indonesia, I think it was done in November 2017. And I think still there are a lot of areas for the improvement. For those areas for the improvement, I think we can work together. Those technical areas, we have technical experts in all those areas. So we should really work together for those technical areas for responding those emergencies efficiently. So those are my answers in the meantime. But I see many questions from the Q&A session. Maybe if you can compile all those questions to me, then if you send it to me, then I will try to address those questions later.
Thank you so much, Dr. Jee. Yes, indeed, if you don't mind, I think in your slides, you also have your email there. So I encourage those of you who have not, whose questions have not been answered, to email directly to Dr. Jee and also to Dr. Phillips if you wish for some questions that have not been answered. So I'm going to have to end the discussion because it's time. I'm very sorry for going over time, but I think that is because we have had such a rich discussion. I'm not going to summarize, but I think based on this discussion, and there are similar interests between Indonesia and the ROK, and I think we look forward to closer cooperation between the two countries in the future. Yes, there are new challenges due to the pandemic, but I think the spirit of working together still remains the same between the two countries. So I would like to thank all of the speakers, starting with Pak Desra and then Dr. Jee, Dr. Phillips, Ambassador Kim, Ambassador Umar Hadi. Thank you all for the kind remarks. We look forward to further cooperation with the embassy as well in this. And please stay tuned to CSIS webinars in the future. If you log into our social media and YouTube session, you will find our future webinars in the following days. So thank you again. Wish you all a very good afternoon and see you again in different occasion. Thank you.
Thank you.
Thank you. Thank you for having me. Thank you.
Thank you, Dr. Jee.